Good morning, Jones. I am the co-founder and former chief at Dear Pandemic, and I am so delighted to be back with you for a live Q&A this morning. I'm really excited because we have fancy new software. Look how fancy we got over the summer. I have new buttons and graphics and stuff, and I am delighted to be joined today by three of our wonderful nerdy girls who are in the green room waiting for me to bring them in. So I'm going to start with Dr. Jennifer Dowd, who is joining us from the UK on her Saturday afternoon. Dr. Dowd is the current editor-in-chief at Dear Pandemic and is also a PhD-trained researcher in public health and particularly infectious diseases. And next up, I'm going to bring in Dr. Sarah Coles. Dr. Sarah Coles is a family physician practicing in Phoenix, Arizona, and she's been a contributor here at Dear Pandemic for the last probably a year, right, Sarah?
Awesome. Yeah, I think we just hit my anniversary.
I think so too. So thanks for being with us for a whole year. Sarah is also an expert in, she does family practice, and she's also an expert in vaccine recommendations and vaccine practices. And finally, I am also joined by Dr. Amanda Simonek, who is in Milwaukee, Wisconsin at the Zibler School of Public Health at the University of Wisconsin-Milwaukee. Amanda is an infectious disease epidemiologist, infectious social epidemiologist, just like I am. And we're going to be talking today all about booster shots. So I'm really excited. Are you guys excited to talk about boosters?
Yeah.
I saw some excited. Yeah. So our heads are kind of spinning with all of the great news that came out yesterday. It was a huge day in the science world. We had good news about a potential, a successful trial of a treatment for people who have COVID-19. That's really exciting from Merck. We also got the news from the FDA that they have planned a couple of upcoming meetings to talk about mix and match vaccines, boosters for Moderna and J&J, and vaccines for 5 to 11-year-olds. I'm so excited. I have 2 kids in that age bracket. And
Me too.
Yeah, so does Amanda. And so we're really excited about that news. I know everyone's been waiting for it. So thanks to Bridges for the deaf and hard of hearing for providing ASL interpreter services this morning. We're really excited to offer this content to a broader audience with their help. All right. So we have a lot of questions about boosters. It's nuanced and complicated, and so we're just going to dive in. Does somebody want to tell us what is the current status of boosters in the U.S.? First of all, what are boosters? How is a booster different from the primary dose that we got?
So a booster shot is when you've got your first series, that primary dose. So either your first shot, if it was a 1-dose shot like J&J, or your first 2 shots, if it was one of the mRNA vaccines like Moderna or Pfizer. So if people who had a normal immune response to the vaccine, and they get a 3rd shot, that's called a booster. And that's to keep your immune response up because over time, the immune response might go down or wane. People who were immunocompromised who got a 3rd shot, they just got a 3rd shot. It wouldn't be considered a booster because they probably didn't have a normal immune response the first time around.
Great. And who can tell which one of us wants to cover at this point in the US, who is recommended for a booster? It's like really complex.
Yeah, I legit pulled it up on my screen because it's really complex and it's hard to remember all the time. So the CDC gave 2 different kind of groups, a should group and a may group. The should group are people who would very, very likely benefit from a booster shot, there's pretty good certainty of evidence that these folks will get something better from getting a booster. And that's people over the age of 65. People over the age of 14 who live in a long-term care setting. So someplace like a nursing home, assisted living, a residential care setting, or kind of a group home. people over the age or 50 to 64 who have underlying medical conditions that put them at higher risk for getting severely sick from COVID. So that's a lot of different people. Those are the same groups we've been talking about for a bunch of other different things. So people who have lung disease, diabetes, people who are pregnant, people who have kind of any other medical problem that might make them at risk for getting really sick if they get COVID. The CDC has a second group of people, the May group of people. So these are people who we should talk to about boosters because they might benefit. The benefits probably, well, almost certainly outweigh the risks of getting a vaccine, but how much it benefits them is still a little bit less known. So these are people who are aged 18 to 49 who have those same underlying medical conditions. And then people who are 18 to 64 who have high risk exposures, typically in like an occupational work type setting. So healthcare workers, first responders, food and agricultural workers, people who work in corrections, all those folks would also potentially benefit from a booster.
Excellent. Thank you for the the backstory there on exactly who is eligible at this point. This is going to be an evolving situation, as most things COVID have been. We did see this very useful flow chart about who's currently eligible for boosters that came from one of Moderna, the PI from the Moderna clinical trial study. Kizmika, I can never remember. I just think of her as Kizzy because that's who she is on Twitter. She's a vaccine researcher with Moderna, and she made this great flow chart, which I think I can drop in the chat here with my fancy. Did that work?
Yeah, it's our post on it.
Highly I'll have to go check Facebook later.
Highly recommend following Kizzy for not only her SciComm. Yeah.
And I think she worked at NIH when she developed that vaccine, but she just got a cool new job at Harvard School of Public Health. So congrats.
Yeah. Okay, so let's dive in. We have tons of questions and they're pretty nuanced, which is why we're back doing the live on this special occasion this morning. So first, let's talk about mix and match vaccines. We're getting a ton of questions about mix and match vaccines. And so let's just take one example of them. Diane from Olympia, Washington would like to know, should my booster be the same vaccine that I got initially? So Jen, I think you wanted to tackle this one first.
Yeah, this is a great and timely question, Diane, especially because yesterday's breaking news about when the FDA panel would meet for the kid vaccines also included some dates where they're going to meet specifically about Moderna and Johnson & Johnson booster shots, including the possibility of mixing and matching. So those meetings are going to happen on October 14th and 15th in the US. And hopefully that means we'll get an answer about that really quickly thereafter. And this is because the NIH has actually been running a trial looking at virtually all combinations of Moderna, Pfizer, and Johnson & Johnson, doing the primary series of one and boosting with each of the other combinations. And that data is supposed to be available now. So this is extremely welcome news, especially for the about 14 million J&J recipients in the US who I know have been in complete limbo even prior to the booster discussion, just about whether a second shot was needed for protection, especially against Delta. So I know lots of people are excited about this. But as far as the idea of mix and match, many other countries, including the UK, where I am, have already been doing some version of this. The UK is also rolling out a booster program for over 50s. And all of those boosts will be with Pfizer, even though many people in the UK got their primary series AstraZeneca, which is an adenovirus vector, very similar vaccine, similar to J&J. And I think we know, in the initial rollouts, both Justin Trudeau and Angela Merkel, prime ministers, got one Pfizer and one Moderna vaccine. Many European countries and Canada that were using AstraZeneca, when that news about blood clots came out in younger people that was concerning, a lot of countries then switched to giving second doses of an mRNA vaccine to people who had already had one AstraZeneca vaccine. And so it has turned out to be very safe. And there's also, immunological reasons to believe this might actually be a beneficial strategy. And this is called this kind of tongue twister, heterologous prime boost. The idea that the immune system, I think Amanda wrote about this in a previous post, that the immune system is kind of getting a mugshot of that spike protein from a slightly different angle if you give it a different type of vaccine. And that might be enough to stimulate slightly different immune responses. And so there's some evidence that the mRNA vaccines induce really high antibody levels, but the adenovirus vaccines might be slightly better at stronger and more durable T cell responses. And the UK actually has had an ongoing trial, and they found that the first dose of AstraZeneca followed by an mRNA vaccine gave much higher antibodies than 2 doses of AstraZeneca. The double Pfizer gave slightly higher antibodies, but the AstraZeneca-Pfizer combination induced the highest T cell response out of all of those combinations. So I think some people might ask, does this mean that, getting a J&J or AstraZeneca after an mRNA might make sense? And that combination wasn't quite as good as the reverse in the UK trial, but I think we're going to learn some really interesting things from this NIH trial results that are about to be released, because they tried all of these combinations. And so, stay tuned for those October 14th and 15th meetings that are coming up. I think it's going to be really exciting for those of us finally waiting for this mix and match data.
Yeah, and we will definitely be updating you. The FDA is going to be meeting and hearing the data from that trial and a more general report from NIH about mix and match dosing on October 15th. And so we really look forward to hearing, and we'll definitely let you know what we learned from that too. And if you want to join us and watch the whole FDA meeting, we will be there. So, be square. So in general, though, I wonder, follow-up question about this. In general, are vaccines, should you get the same one that you got in the first place when you get a booster vaccine? Sarah, I know this is part of your area of expertise, so why don't I throw that one to you?
Yeah, so it kind of depends on the vaccine and the situation that you're in. So vaccines come in combination where you get a bunch of vaccines all kind of in one shot, or these kind of single vaccines that are vaccinating you against one specific illness like the COVID vaccine. For combo shots, the Advisory Committee on Immunization Practices, which is that independent advisory group to the CDC that gives us our best recommendations in the US for vaccination, says really we should try to do the same combo shot kind of throughout your series. That's not always possible because we don't always know which shot you got in the past. And so we do our best and we try to do that. But if we can't, it's better to just get vaccinated. For those single antigen shots, so those things that are vaccinating against only one thing, a lot of them we have good data that you can mix and match brands and types. So for things like the Haemophilus influenza vaccine, hepatitis B, hepatitis A, rotavirus, and meningococcal, we all have good data that you can kind of get any of them, whichever brand, whichever specific type of antigen, and mix and match, which is really nice because it's much easier if you move or if you have a different clinician who's giving your vaccines, or your doctor just holds a different vaccine now because they got a new fridge. Who knows? There's lots of reasons that people might get a different vaccine shot. All the different shots do have different concentrations and different amounts of that antigen, and sometimes different dosing series. So sometimes you have to get it at different intervals. So if you're getting kind of the mix and match shot for other vaccines, then we try to give the higher number of doses that's recommended. So if one hepatitis B vaccine is 2 doses and another is 3, and we mix and match, you get 3. So that's a bit of a downside, but otherwise it's usually okay. There are some that we say we don't do that, like the DTaP vaccine for kids. You get the same one throughout as much as possible.
Interesting. Great. So that's helpful sort of general info, and we can't wait for more details from this NIH study. So let's go on to the next question here. A lot of people are asking about timing of their booster shots, as well as this question about what's in the booster and does it cover Delta? So just as one example, Ruth from Talkeetna, Arkansas, probably butchered that. Sorry about that, Talkeetna. When can we expect a variant-specific booster shot, and should we wait for it? Amanda, I know you wanted to tackle this one.
Yeah. So I think it was Talkeetna, Alaska, which is exciting that we have followers in Alaska.
Yeah, Alaska. AK is Alaska. Thank you. Thanks.
So we've talked about getting a booster with the same formulation of the original vaccine. We've talked now about getting a heterologous boost of a mix and match strategy. And then back in May, when we started posting on this, the other option that we talked about is getting a variant specific booster. So there are ongoing trials on this right now. And so some of them are focused on the Beta variant. Anyone remember that? Beta so 2020. Anybody? And then now, obviously, the Delta variant, which is the dominant circulating strain. But so Pfizer has 2 trials, and they are testing one with just a Beta variant, one with just a Delta variant. Moderna has several different options rolling. They're testing Beta, one with Delta, one with both Beta and Delta, and then with Beta and the original SARS virus targeted. And so when more than 2 viruses are targeted in a single vaccine, that's a multivalent booster approach. And so with Moderna, several of these candidates are in phase 2-3 trials. And, I think both Pfizer and Moderna plan to continue as new variants of concern emerge to quickly use that technology to develop a vaccine targeted against those and test them. AstraZeneca also is testing in phase 2-3 trials of a vaccine tailored to Beta. Novavax says they're doing a Beta vaccine, but we haven't really heard more about their primary vaccine. And then I haven't seen any reports of J&J testing a variant-specific vaccine, but I may have missed it. So this is all happening where, these companies are testing it. How soon something like this would be available, I think I've only seen that Moderna thinks Pfizer by the end of the year thinks they'll have some results. Moderna, I'm guessing, would be shortly after that. And maybe we're still in that wait and see period for AstraZeneca and Novavax. But I think the question is it really even necessary? And what we've seen emerge is that boosters with the same original formulation are generating a robust increase in antibodies across the board, across these different companies. And so I think we should look to those results, from the trials of vaccine-specific variants, but that there needs to be some really profound evidence that is fundamentally a better approach, mainly because it would then have to go through the approval process. Resources would have to be shuttled away from the original, vaccine production to manufacturing these different variant specific boosters, and then it would be sort of a huge science communication effort too that would try to articulate, well, is it really necessary to get one versus the other? And I just think that right now, what's closer to approval is boosters of the same original formulation. And I would not wait if I, was in one of these eligible groups for a Delta specific. There's evidence that antibodies are increased against Delta with these booster approaches. So there doesn't seem to be concern, or I would say necessity at this point for a vaccine specific booster. I still think, it's beneficial that we are now understanding how to do this. In case there is a variant of concern or escape variant in the future. And, when and if we get to a point where this process for COVID vaccines is a more well-oiled machine, like it is for, say, influenza virus every year to quickly produce and identify a reformulation, maybe this technology will be used in the future. But for now, I'd say we're not there yet. Don't hold out for a variant-specific booster.
Yeah, and just to reiterate, the vaccine that we already have is really does cover the Delta variant very well.
Oh.
People who, I mean, we are seeing a lot of breakthrough cases, but that's because we are seeing a ton of cases. Delta is more contagious. And so there's just higher exposures. But the vaccines we already have across the board are really good protection against people ending up at the hospital or dead of COVID-19.
Yeah.
So I would not wait. I agree with
Right.
you.
Which is why I think there'd have to be like super compelling evidence that there was some benefit beyond what we're already observing with the booster of the original formulation.
Yeah. And what I can see happening is we might phase in, replace the COVID-19 vaccine that's available with one that is multivalent or that covers some specific, like an either or kind of a thing. Like, do I need this shot or that shot? They're going to be very comparable. So,
and we're not there yet, so don't wait.
and it's better to get it now rather than with COVID-19 vaccines. All right, so let's go to, here's a question about boosters and flu shots, because these things are kind of happening at the same time. It's flu shot season. I got my flu shot last week. I felt like absolute trash for a day and a half. It was a particularly rough year for me for the flu shot. What do we think about getting the flu shot and your COVID-19 booster at the same time? And this question comes from Rachel from New York. Sorry, I'm struggling a little bit. There's so many graphics available to me. I have to go find them. So Sarah, I bet you know the answer to this question.
Oh yeah, I talk about this all day, every day now that it's flu shot season in the Northern Hemisphere. So often people are asking, when can I get my flu shot in relationship to my COVID shot? And the good news is it's whenever. You can totally get them at the exact same time if you want to, which is fantastic because it makes it a lot easier. When this first rolled out, when we first got the COVID vaccine, we told people you had to wait in between shots with your COVID. And that's no longer true. So it looks like co-administering, so getting multiple shots at the same time, doesn't have any significant safety or efficacy effects. Studies of this are still ongoing to make sure, but we haven't seen anything really scary or bad. So it's more about getting it when it's convenient for you to get it. So whenever you can get your shots, get those shots. Do know that both of the vaccines, flu and COVID, are kind of reactogenic, meaning that a lot of people get some kind of symptoms from their immune systems ramping up and turning on. So things like feeling a little feverish, having headache, having a sore arm, feeling tired, maybe getting some lumps or bumps in various parts of your lymph nodes. That's all really normal after both the flu shot and the COVID-19 shots. And you can feel pretty lousy, like Malia did, for a couple of days. And it usually just goes away all on its own. If you get them both at the same time, you might have more of that. So be prepared for having a day or two that's a little bit rough. I'm totally fine with that. I'm all down for just getting sick in one day, or feeling sick, because you're not actually sick, right? But feeling sick for one day and then making my family wait on me and milking it for all that it's worth, which is what I usually tell my patients, which is just like, oh, you just tell your kids to go get you stuff. Like, just make this be a day for you. But it is, if that's not something you're down for, then it's okay to space them out a little bit too.
Although on the flip side, you'd maybe have some vaccine-related side effects twice then, rather than just the one time.
That's true. You can milk it twice.
Okay, so yes, we can get our flu vaccines on the very same day that we get our COVID-19 boosters. Thanks for that. So here's another one from. Let's see. We've got Julia from Memphis, Tennessee. If I get a breakthrough infection, is that like getting a booster shot?
All right.
We are.
Do you have me there? I lost you for a second. All right. Cool. Yeah, I think this is a fascinating question. I've been wondering it myself, and I think it really speaks to what our long-term relationship will be with SARS-CoV-2 if it, continues to circulate for years to come. and becomes that famous endemic or endemic-ish seasonal coronavirus. We know that people who were previously infected with COVID-19 who get subsequently vaccinated have this really supercharged hybrid immunity that is extremely powerful. So, it would be very interesting to see what happens in reverse if you've been fully vaccinated and then have a breakthrough infection. I've been waiting to hear some actual data on this, immunological data, looking at neutralizing antibodies or some other immune correlates. But so far, I haven't seen it. If anyone knows of any that's out there, please send it our way. I think we should be seeing it soon because we know a lot of these, quote, breakthrough infections are happening. But I've heard some speculative ideas from virologists such as Shane Crotty that it probably does serve as some type of booster. Kind of like the original infection, this might vary a lot across different people. So for example, if your neutralizing antibodies had stayed quite high from your vaccinations, you might test positive with a breakthrough infection as that virus starts to replicate in your nose and throat. But this replication might get shut down very quickly because of your high levels of antibodies. And that might not provide a lot of additional stimulation for your immune system. But if you have a symptomatic disease after vaccination, which is definitely happening, I think there's probably a good chance that we'll find out that this provides a significant boost to antibodies and overall immune response. It's just, unfortunately, we don't have that data. We're still waiting on it. But I think the likelihood over, the long term is that repeated exposures will continue to remind your immune system what's going on. But we need to wait for more firm data on this. But I know the practical question is, if you have had a recent breakthrough infection after full vaccination, how should you be thinking about these boosters? And I'd be very curious what Sarah has to think from a clinical perspective. But I think if you are in one of these higher risk categories, over 65 or clinically vulnerable, the booster still probably is a good idea as insurance against another reinfection. If you're in one of these lower priority groups that maybe can rather than should get a booster, I'd say there probably isn't as much urgency to get a booster if you've had a confirmed infection after full vaccination. But I would be really curious about what Dr. Coles thinks about that.
I totally agree. And I think that it's exactly what you said. The big point is we don't know what people's immune response is after a breakthrough infection and whether or not that really does confer enough immunity to make it less likely for you to get sick again or really, really sick and need hospitalization or even die. So because that information is a little bit unclear at the moment, and everybody's immune response to getting infected is different. So some people have a super strong immune response and some people don't. The vaccine is a much more consistent way to get an immune response that is much more trustworthy and much more likely to get this kind of continuous immune response. So I would say, yes, I would consider boosters for all of these folks after breakthrough infection. And if you're in one of these May groups, go talk to your primary care clinician and ask about what are the risks and benefits for you for getting that vaccine.
Yeah, I think that is terrific advice. We did also see, I did a really close read of the J&J results, the sort of interim results that came out. I guess that was just last week, and it feels like longer. And they did this really small study of neutralizing antibodies in a couple of different treatment groups. And it just happened that a couple people in their study got breakthrough infections. Actually, I think it was just one person. And so they did find a big increase in neutralizing antibodies. So I think there are like hints out there that this is what's happening, that an infection after vaccination does kind of behave like a booster, but that's one person. So it's certainly not what we would call robust scientific evidence on this at this point, right? Could it hurt you could it hurt your natural immunity or your immune have a boost after you've been infected with COVID-19? I don't know who wants to tackle that one. I surprised everyone with that one.
I don't think there's any evidence of harm for that. So I don't think that's very likely.
Yeah, from my understanding of how vaccines work and the immunology underlying vaccines, there's no, your immunity can get stronger and it can wane, but it can't wane, beyond nothing. It can actually get worse as a result of having been exposed to the virus again. All right, so let's move on. I think we have at least one more question here. And I actually think this one is also for Sarah. So, is there guidance specifically for pregnant women to boost or not boost? And do you know anything about the timing of when it might be best? And this question comes from Kate. We got a lot of questions like this, though. So,
sorry, Malia.
That's okay.
And thank you, Kate, because I am super, super happy that you asked this question. The CDC actually just a day or two ago released a health advisory action alert because the immune uptake or the vaccine uptake in pregnant people has been very low. And this is a really high risk population. So as of September 27th in the United States, there have been over 125,000 lab confirmed cases of COVID in US pregnant persons, which is a lot, 22,000 hospitalizations and 161 deaths. So that's terrible, really, really bad news. And at that time, only about 31% of people who were pregnant were fully vaccinated. So not good. We're not in a good state for vaccination and pregnancy. So the first point is that people who are pregnant are absolutely indicated to get the primary vaccine series. Those folks should get vaccinated. There has been no significant safety concerns from the vaccine in pregnancy, and it really does reduce the risk. We know that people who are pregnant who get COVID are at a higher risk of getting really sick, of needing to be hospitalized, of needing to get intubated, meaning they have a tube put down their throat to help people breathe, of dying, and of their children being really sick, so needing to be admitted to the neonatal intensive care unit or the NICU. So it's a big deal. We really want to get people vaccinated. The pregnant folks are in that group for the May get a booster shot. So they would be considered having an underlying condition that would put them at higher risk of getting severe COVID-19. So yes, you absolutely can get the booster shot. And the timing is the same for anybody else. 6 months after you've completed your primary series, and any time during the pregnancy would be considered safe and appropriate.
Great. Okay, thanks for that.
Emily, what about, I know we like to do our homework typically, but this question and the comments from Nikki about, 6 versus 8 months and, whether trying
I was just going to go to that. I was going to see if I can do the fancy thing where I make it show up.
Okay, that'd be really nice. Yeah.
All right. You want to tackle that?
I might throw it to others, but yeah, I can kick it off. So the question is, if you're around 6 months past your primary series, you could get boosted now, but what if we have an even worse surge in a couple months down the line in the winter? Would it be better to kind of get your big boost right when, the winter surge is happening? And I think it's an interesting question that we don't know the answer to because we haven't seen the dynamics of the waning immunity, past the third dose. But my impression from reading the literature so far is that it could be that, a third dose is actually required to get the more durable, long-lasting response. And so once you get that, it could be that it lasts for quite some time. And so I think trying to game, when are we going to have a worse surge than we're having right now with Delta is a little bit risky. And so I would err on the side of, maybe getting it sooner rather than later. But I'm curious what the other nerdy girls might say.
Amanda, I'm going to put you in the hot spot because you haven't talked for a while.
Yeah, so my
classroom teaching skills are coming out.
One of the articles we already linked to during my answering of the question about variant specific boosters from the Atlantic discusses this.
Yeah, I'll put that back in the chat too.
Yeah. And the headline is there are no simple rules for timing on a third jab. They say, but maybe don't rush it. So like this article is sort of taking maybe more of that stance of when is the surge going to be? I think we always joke. Malia says she has her 8-ball or her crystal ball.
It's at my work office, so sorry.
Oh, sorry, it's not available today. Next time, So I think any of us who would try to predict, like even us who are well entrenched in all of this, when the next big surge is going to happen, I don't feel like I can do that, and I wouldn't. I don't think there's necessarily any reason to hedge your bets at this point, like, until we get some indication that there is some optimal timing based on data, or the longevity of the antibody, response being elevated after the boost, or other immune parameters. I don't think we should be speculating.
Yeah, you know what? I think just get it now, because you know what prevents surges? Vaccinated people.
True. Right. We can, prevent you as a vaccinated person from transmitting to others, having a breakthrough infection, that, and alongside that, increase the number of people getting their primary doses. Like, that's going to prevent, the need for a surge to happen, or not the need, there's no need, prevent a surge from happening, the need for some guessing as to the optimal time to do the boost.
Yeah.
Just do it.
Yeah. It's not like, when we look at the sort of the big picture of how immunity kind of, it builds and then potentially wanes again. It's not as if you get a booster and then in 1 month it's gone, right? That's not how vaccines work. So if you get a booster now, you are still going to be just as well protected in 8 months as you would be if you got the booster in 8 months. In fact, you might be better protected, because it does take a little while for your immunity to build. And so I say the sooner the better.
Put a plug in too, that vaccines aren't our only layer of protection. So if we were to enter a surge and you had a boost at a certain time, you can wear a mask, and you can, be careful about social distancing again, or, reducing your contacts, and having good air filtration in your places where you are, right? So it's not our only tactic, and we are not putting all of our eggs into that basket anyway.
Yeah.
I really appreciate the question from Nikki, because there is this idea of what are the unintended consequences of rushing into this booster campaign? Should we think this through? And everything is in such flux, and we're learning more every day. So I do appreciate wanting to anticipate the next phase of the pandemic, and but I think
and I also really appreciate, and I know some of our readers will make comments about this, that, much of the world is still unvaccinated. And so this idea that the richest countries in the world are worried about the difference between 6 and 8 months for their third dose, when most of the world has 0 doses, it's a little, that's a really privileged, right? And so I struggle with that, but I also know, based on the way vaccines are manufactured and distributed worldwide, that me declining my booster does not actually deliver a shot to someone else in the world. And so I think it's incumbent on those of us who have access to get as well vaccinated as we can get. That's kind of where I land on that.
Yeah, that's a really good point.
Yeah, very well said.
All right, so I think we're going to wrap it up. I did see lots of other questions in the comment section here. This is so cool. I can actually see the comments live. I don't know if you all can see that, but as the host, I can see the comments coming in, and it's super cool to be able to see them without having to switch to a million different windows. We have lots of questions about kids and kids vaccines and kids vaccines timing and kids vaccine safety and kids. We don't know the answer to any of those questions right now, but we're really excited to get some more information, especially at the FDA meeting that has been scheduled for October 26th. It's going to be like my birthday on that day. I am definitely going to be watching the
you'll be in a Halloween. You'll be in a Halloween costume, won't you, Malia?
Well, not on the 26th, but on Halloween, yeah, I will be for sure. Okay. You remember the live last year when Lindsay and I both dressed up as witches? That was amazing. Okay, so we're going to wrap it up here for now. I know you have more questions. We have more answers, and we use lives on pause for a while. The last one we did was in May. I did have a very successful summer of doing lots of camping which was my goal. I went backpacking and lots of other fun stuff. I've now reached the point where I have had enough mosquito bites for the whole entire year and I'm done. I think there's some chatter within those nerdy girls of bringing these lives back on maybe a month. And so who knows, maybe we will start doing these lives again monthly. If you would value that, I want to make a pitch to consider donating to our nonprofit to support our work. The button is right on our website, and you can also subscribe on our Substack newsletter. I think I can put the link to that right here in the chat so that you can access it. We are struggling to figure out how to make all of this work from both an administrative and a financial perspective. And so if you want to support us, that would really be appreciated. I have one other pitch that I've got to make before we close here today. Carita Pandemia, which is our Spanish language mirror site, is seeking volunteers to help with community engagement. And by community engagement, we mean helping to manage the comment section. And so if you are a Spanish speaker and you want to help out with this, I'm going to put a brief form in the chat right now. And you can fill that out and let us know about your availability and your contact info to the team as someone who can help us out with community engagement work in Spanish. So thanks for that. And thanks for joining me this morning, all four of you. It's wonderful to see your lovely faces. And maybe we'll see you again next month. Until then, keep following us on social media. Check out our website, dearpandemic.org. Put all your questions in our question box. And stay safe and stay sane.